Hello everybody, my name is Dr. Sternberg and I'm a plastic surgeon at Ponte Vedra Plastic Surgery. But first and foremost, I'm a physician, as are all my partners. And it's our job as physicians to care for our patients, and when we care for our patients during examination, to get the best medical care we can give that's available to us at this time, in addition to outstanding cosmetic surgical results. So everyone knows that dreaded medical intake form that you fill out when you first go to a plastic surgeon's office or any medical professional's office, and you got to fill out a bunch of pages, and it's the pain in the butt, and nobody wants to do it. But yes, they're painful, but they're also very important. We use those medical intake forms to basically evaluate a person's medical history, and most importantly, what we're using it for is your current medical history and also your family history. So as part of the family history, we look at what in your family history puts you at risk for certain, elevated risk for certain background disorders like breast cancer, ovarian cancer, things that can affect our surgical experience and our surgical results. So that's what I'm here to tell you about more today. Is I wanted to delve into the topic of genetic testing a little bit more and why we look at that. So when we look into that medical intake form that you guys fill out when you first get here, we're looking at a couple of main things. We're looking at, has the patient had any relatives with breast cancer in their family? And if so, have those relatives been under the age of 50, especially for direct relatives like a mother or father having breast cancer under the age of 50. If it's not a mother and father, have two generations, consecutive 2 generations of family developed any type of breast cancer. So for instance, the patient's mother and her aunt on the same side of the family that are over 50, but that also puts people at increased risk. So these are the kind of things we're looking for. This is a cheat sheet we'll have some patients fill out if we're worried about that, but also we'll use that in our evaluation of the patient to determine other things. Have there been any history of male breast cancers in the family? Has any of the breast cancers in the family been triple negative tumors? Is there Ashkenazi Jewish background or a history of melanomas, pancreatic cancers, brain tumors, those kind of things? Those put people in a separate subcategory of risk that may be elevated, and we want to know that ahead of surgery. Why? It's really important because if we're planning on doing a big procedure on somebody, a breast lift, a breast reconstruction, a breast revision from a previous surgery, if they're at a high risk of getting a breast cancer, that may change the entire algorithm of what we decide to do. So if we're thinking about doing a breast lift, mastectomy, makeover on a patient with a very strong family history of breast cancer, we'll perform a simple test that's a genetic screening test. The maker of the test is a company called Myriad. It's basically a saliva spit test, or it's also a blood test. You can do either one. We tend to do the saliva spit test here because it's easier. And if you qualify for the test based on those genetic risks, we'll run the profile on you. And for instance, if it comes back positive, it's a waste to do a big cosmetic surgery on a patient for a breast surgery that has a very, very high risk of getting breast cancer in the future. So that's why we're looking at these things, because as your surgeons, but also as your medical experts, we want to eliminate patients that may not need cosmetic surgery this time. We may want to go down a different realm of discussion with that patient. So we may, instead of talking about a cosmetic breast lift, we may be talking about, your genetic results came back, you're at a very, very high level of developing a breast cancer. So instead of doing this, we may want to go through insurance and do a nipple-sparing mastectomy with a revision or mastopexy or lift or in the future instead. So sometimes it actually changes the algorithm of what we do. And not everybody's positive, and most patients go right to surgery without any problems, but we try to identify these risks ahead of time. So again, the most common question is, why do I need genetic testing? Not everybody does. If we identify certain risk factors in your history that put you at very high risk, then we'll test you if that's appropriate. Some people come here having already been tested through the GYN or the primary care doctor, and so we don't need to test again. But if we do test and you are in a very high elevated risk, it may change what we do. The second question is genetic testing covered by my insurance? Absolutely, almost universally, these genetic tests are covered. If there's any problem with coverage, the company will call you ahead of time first and say, hey, you know what, your insurance company's giving us a little pushback, we need a little bit more genetic history. If at that point they can't get it covered, they sometimes write off a lot of the tests. And then you're responsible for maybe $200 out of the test. But almost always this test is covered, especially today as we get more advanced and we understand more about genetic risks. So if you're at risk or high risk, the test is almost always covered. So those are the two major questions we usually hear. And the third is, what do I do if I am positive? And then if you are positive, we usually send you to a genetic counselor or an oncologist that can describe to you at length what your actual risk is. Your BRCA positive or your BRCA2 positive or whatever the case is. They may say, based on your risk, your age, your family planning, you may want to consider a mastectomy in the next year or two. Or maybe, we're just going to monitor you for a while. So, and again, that will change the decision, because if we're going to potentially have a mastectomy performed on you in a year or two, then we're not going to do a big, expensive cosmetic procedure now. So that's how genetic testing really enters in our thought process now as plastic surgeons. Again, members of the medical community were very proactive in checking for and pre-screening for genetic disorders. And that's just another service that we offer and provide for you guys if we feel it's worthwhile and necessary here at Palm Beach Plastic Surgery. So I welcome questions, comments, and you can always email us if you're concerned. But again, this test is not done on everybody, but if we identify certain risk factors, then you would potentially offer you the testing at your appointment during a consultation, or even after you've been a patient for a while, and we pick that up later. So as the medical climate changes and we learn more things, we may add things like this into our practice, and that this is ever changing and evolving. But right now, Myriad offers a very, very detailed genetic test that's at the forefront of genetic testing right now, and we definitely provide that here at our office. So if you have any questions, let us know. Otherwise, I hope this has been helpful and providing some more education about genetic testing. Again, I'm Dr. Sternberg of Palm Beach Plastic Surgery, and thank you for listening.
That was good.